rheumatologist
Hello, everyone. This is Dr. Diana Girnita. I'm the founder of Rheumatologist OnCall, and I wanted to share with you this presentation about arthritis, the causes, the symptoms, diagnosis, and how we treat arthritis. This is a presentation that I recently gave to the National Arthritis Foundation, and I thought it's very important to share it with you. So, as you probably know, arthritis becomes an epidemic disease. It is on the rise. The diagnosis of arthritis and the prevalence of arthritis is increasing. If in 2005, it was estimated to be about 46 million people with arthritis, in 2020, there were about 63 million people with arthritis, and it is estimated that the number will increase, and in 2040 will be about 78 million people with arthritis. And when we look at arthritis, we think about arthritis in different ways. We think about arthritis being related to inflammation or being related to wear and tear or degenerative arthritis. As rheumatologists, we also think about arthritis that it could affect just the spine, or it could affect just the peripheral joints, or it could affect both. Now, when we look at types of arthritis, we also consider arthritis that will involve one joint or will involve multiple joints. But arthritis can be also associated with other autoimmune diseases like psoriasis or lupus or Sjogren's syndrome, and arthritis can be seen even in vasculitis. But as I said, there are different types of arthritis, like inflammatory arthritis, such as rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, reactive arthritis, lupus, gout, or pseudogout. Or there is degenerative arthritis or osteoarthritis, or as you know it, wear and tear arthritis. Now, let's talk about the most important features of inflammatory arthritis. So this type of arthritis affects primarily young people under 45 years old. It will affect, in most cases, multiple joints. It can affect peripheral joints, but it can also affect the spine. Patients will present with pain and swelling of the joints, and also with morning stiffness, which usually lasts more than an hour. What is specific for this stiffness is that it will be improved by movement, and it is worsened by rest. So if you sit for a prolonged period of time, the stiffness comes back and it's going to become worse. When we talk about osteoarthritis or degenerative arthritis, there are certain features that you have to be aware of. This type of arthritis increases in prevalence with age. It will affect multiple joints like the hands, the knees, and spine, and those are joints that you use the most. It could cause pain, but not as much swelling. It could cause morning stiffness, but the morning stiffness is usually limited under 30 minutes. Movement makes the pain worse, and rest, it will help the pain. So if you sit, the pain will become better. Now let's talk a little bit more deeper about different types of inflammatory arthritis. And I'm going to start with rheumatoid arthritis. So rheumatoid arthritis affects primarily females, but it can be seen in males as well. And it can affect small joints from the hands and feet. The hands are usually affected in a symmetric and bilateral pattern. Morning stiffness is there for more than an hour, and it does improve with movement. However, if you let rheumatoid arthritis untreated, it can lead to erosions of the joints, ankylosing, and severe disability. Now let's talk about lupus arthritis. Lupus, as you probably know, affects more females than males, more Blacks and Asians than white people. It can give you many other symptoms like the malar rash, as you can see here, the butterfly rash. It can increase the size of your lymph nodes. It can cause oral ulcerations. But when it comes to arthritis, it will involve small joints from the hands. It can involve the knees. It can cause pain and swelling and significant morning stiffness for more than an hour. The arthritis is usually non-erosive and non-destructive in comparison to rheumatoid arthritis. This is a type of lupus arthritis that we call Jacquard arthropathy, because in this case, the joints look deformed, but they are deformed because of retraction of tendons, not because of ankylosing of the joints. Now let's talk about psoriatic arthritis. This is also a type of inflammatory arthritis. What is specific for psoriatic arthritis is that this is not symmetric, not bilateral. It can involve both the joints and the tendons, and it can involve peripheral joints, but also the spine. There are cases of psoriatic arthritis that can be destructive, and like in rheumatoid arthritis and lupus arthritis, these patients will have severe morning stiffness that is improved by movement, but it will accentuate if you take a rest. Many patients with psoriatic arthritis can have a destructive form of arthritis and can end up with a lot of other problems. Now, ankylosing spondylitis is also a type of inflammatory arthritis. It can affect the spine, but it can also affect the peripheral joints. Many patients with ankylosing spondylitis will also have gut and eye inflammation. And what is specific for ankylosing spondylitis, it is that it can also affect tendons. Like other inflammatory arthritis, will cause morning stiffness that will be improved by movement. If this disease is untreated, can lead to ankylosing of the spine and severe disability in the patients. Now, let's talk a little bit about gout and pseudogout. Gout will usually affect the big toe. We call this podagra, but can also involve other joints and is not symmetric, can be extremely painful, and the joints will be swollen and very red. Many patients with a metabolic syndrome, obese, that eat a lot of red meat, or they have a family history of gout, will experience these episodes of arthritis. And it's always paired with a high uric acid. Now, pseudogout, on the other hand, tends to affect the wrist and the knees. And in contrast with gout, it is caused by calcium deposition in the joints and not by uric acid deposition. Now, reactive arthritis is also a form of inflammatory arthritis, and it can be caused by viruses like hepatitis virus or parvovirus, by bacteria like Streptococcus or C. difficile. It can be caused by HIV or Lyme disease, but there are other causes for reactive arthritis as well. Reactive arthritis tends to involve one or few joints, and it can happen usually a few weeks after the infection. The joint is red, swollen, and very painful. How to diagnose arthritis? It is very important to get a good history from the patient, because history in rheumatology makes probably half of the diagnosis, if not even more. Then we do take laboratory tests. We do perform a lot of imaging like X-rays, CAT scan, MRI, and ultrasound. And in certain situations, when we suspect infection, we will try to get a joint aspiration. The most common laboratory tests are CBC or CMP, which are regular blood work for any patients, markers of inflammation. We do check rheumatoid factor, anti-CCP antibodies. We may check a uric acid, an ANA, and sometimes we order a full panel for the ANA, a serum electrophoresis, and sometimes we do obtain an iron level. Let's talk about X-rays. So X-rays will show just the bone changes. It will show erosions, but be aware that X-rays do not show inflammation. When we look at X-rays as rheumatologists, we can see certain changes that are specific for rheumatoid arthritis, like this ulnar deviation of the fingers, or we can see changes like these ones that are specific for patients with psoriatic arthritis. We call this pencil in a cup. Now, MRI with contrast is very sensitive to show inflammation, but the disadvantage is that MRI is usually very expensive. But when we are in doubt, we can always check an MRI with contrast, especially for people with back pain, where we suspect inflammation, like sacroiliitis. Musculoskeletal ultrasound, it's a non-invasive type of imaging test that may show inflammation, can show erosions, can show signs of gout, but sometimes is technician dependent. How to treat arthritis? Many patients, when they are diagnosed with arthritis, they will ask me what are their non-pharmaceutical and pharmaceutical options. So we will discuss about both. I will tell you that lifestyle interventions are crucial in patients with arthritis. And if you watch my channel for a while, you will know that I talk about a lot of these interventions. But here it is: weight management, nutrition, exercise, sleep, and stress management are all extremely important for patients with arthritis, any kind of arthritis. Now, this is one of the articles that I have published about the role of nutrition in rheumatology patients. You can find it on my blog, or you can find it on Kevin MD website. This article will describe my journey from practicing traditional medicine to adopting integrative medicine in rheumatology. As a physician and scientist, I believe that targeted therapy offers great tools for patients, but sometimes this is not enough. And that's why I believe in the power of integrative medicine. I have even created an online course that talks about nutrition in patients with inflammatory arthritis. And I will link the name of the course in the bottom of this video. There are 3 things that I tell my patients to reduce and eliminate: sugar and salt, processed foods, and bad oils, especially vegetable oils and trans fats. There are 7 things that I tell my patients to include in their diet, like enzymatic fruits, vegetables and legumes, leafy greens, whole grains, fermented foods, nuts, and olive oil. There is so much evidence about the role of fish oil or omega-3 supplementation to decrease inflammation. This is one study that talks about the role and the effect of fish oil in patients with rheumatoid arthritis. This was a randomized, double-blinded control trial that showed that patients that took fish oil or omega-3 supplementation in addition to their classic therapy of methotrexate plus sulfasalazine plus hydroxychloroquine, they did show to have less pain and less inflammation. And that is incredible. In my YouTube channel, you will find another video about fish oil and omega-3 supplementation in patients with rheumatoid arthritis, and another video about fish oil in patients with arthritis. I also encourage my patients to include a lot of spices in their diet, like turmeric, garlic, or ginger, because they all have anti-inflammatory effect. Now, when we talk about diets, the most evidence that we have is related to Mediterranean diet. And Mediterranean diet, not only that can decrease pain and joint swelling, and improves the physical function, but it will reduce the other cardiovascular risk, cancer risk, diabetes, obesity, And as I said, it's very helpful for patients with arthritis. This year, I was invited as a speaker at the American Congress of Rheumatology. It is the largest rheumatology meeting in the world. And for the first time, I have heard a whole session about the role of food and the role of nutrition in treating patients with arthritis and autoimmune diseases. If you are interested to learn more about the role of nutrition in rheumatoid arthritis, I have posted a video with a lifestyle pyramid that I have created for my patients with rheumatoid arthritis. You will find this article on my blog or on Kevin and D, but you will also find the video in my YouTube channel. I cannot emphasize enough the role of exercise in treating arthritis. Exercise, not only that will maintain your joint function, your joint flexibility, it will maintain your muscle strength, it will improve your mood, and it will reduce the pain. Yes, it will reduce the pain. There are many types of exercises that you can try, but swimming should be number one, or getting in the warm water should be a priority. You can try yoga, you can try other stretching exercises, and you can try Tai Chi. Sleep is also vital for patients with arthritis. Your sleep might be affected by pain, might be affected by medication that you take, by anxiety or depression. And we know there is a bidirectional relationship between sleep and pain. If you sleep less, you're going to be in more pain. That's why I emphasize the importance of regulating your sleep pattern. Stress can affect your mind, but it will also affect your body. And there are many, many studies that will show that if you are in more stress, you will experience more pain. Now let's talk about medication for arthritis. And this is going to be just a brief discussion. There are different types of medication that we use for arthritis, like non-steroidal anti-inflammatory drugs, steroids, DMARDs, biologics, and kinase inhibitors. NSAIDs like naproxen, ibuprofen, meloxicam, colecoxib, or diclofenac are very commonly used in patients with arthritis. However, I have to warn you that you should use this medication just for a short period of time, because they will increase your risk for GI bleeds, for kidney failure, and even increase the risk of heart disease. Steroids like prednisone, prednisolone, or methylprednisolone, they are amazing drugs. They're very powerful anti-inflammatory medication, but they should be used with physician recommendations, used for flare-ups of arthritis and for a short period of time. If you use them for a very long time in high doses, they can cause side effects like increased weight, diabetes, osteoporosis, infections, and increased cardiovascular risk. If you want to learn more about prednisone and the most common side effects, I have posted a video in my channel. DMARDs, or disease-modifying anti-rheumatic drugs, are drugs that must change the course of your disease if you take them for at least 1 year. And they do support improvement in your physical function, and they do decrease your inflammation, and they are supposed to slow down or prevent destruction caused by inflammatory arthritis. Now, there are different types of DMARDs like hydroxychloroquine, sulfasalazine, methotrexate, and leflunomide. Now, let's talk about biologics. And when we talk about biologics, we have to go back to the basics of immunology, because that's how biologics were discovered. So it was found that certain cells of our immune system will produce certain cytokines or certain molecules that will be responsible for inflammation. For example, TNF-alpha or interferon gamma, they were shown to be associated with more inflammation. So that's how researchers develop medication that will block these molecules that will produce inflammation in our joints or in our body. And there are different types of therapies. therapies against TNF-alpha, like etanercept or adalimumab or Humira, therapies for IL-1, like IL-1 inhibitors. I will give you some examples, like anakinra or canakinumab, inhibitors of IL-6, like tocilizumab, inhibitors for IL-17, like secukinumab or ixekizumab. But there are also different types of therapies that were against different types of cells, of immune system cells that will produce inflammation. Let me talk to you a little bit about TNF-alpha inhibitors. There are different types of TNF-alpha inhibitors developed over the last 20, 30 years. The oldest one is called infliximab, followed by etanercept and adalimumab, and more recently, certolizumab and golimumab. They are indicated in patients with rheumatoid arthritis, ankylosing spondylitis, and psoriasis or psoriatic arthritis. Those are indications just for arthritis. But there are some warnings that come with biologics, like increased risk for infections, infusion reactions, malignancy, very rarely demyelinating disease, drug-induced lupus, and congestive heart failure, and very rarely they can cause psoriasis. Now, let me talk to you about JAK inhibitors like Xeljanz or Rinvoq. They do come as well with some warnings like infections, and I always tell my patients to get vaccinated for herpes zoster because these drugs will increase the risk to develop shingles. Other warnings are anemia, very rarely gastrointestinal perforation, and there is an increased risk of thrombosis at higher doses that you have to know about. Another important aspect in people with arthritis and inflammatory arthritis are vaccinations. I always recommend to my patients to get vaccinated or get up to date with their vaccines for flu, pneumonia, shingles, hepatitis A and B, tetanus, and HPV, but also COVID vaccine and meningococcal vaccine. Thank you very much, and I wish you a very good day.
rheumatologist OnCall.com